topic today is the regeneration. Yeah, regeneration of pancreatic islet cells in diabetes patients, and then the stopping the diabetes medication, I mean the drugs, and the insulin injection. So that's the, we call that T1DM. And then I say about the postprandial exercise, like Professor Yako told us about today, the lifestyle intervention, and then diet control. Yeah, I'm actually a CEO of the T2DM Bio Corporate in South Korea, and I was one time the research professor at the Jeonbuk National University in South Korea, and also worked together for the ISO, that is the International Organization for the Standardization, and then FAO, that is the Food and Agriculture Organization, and representing the South Korea. And also during my work at the UN institution, my research field was for the insects, edible insects. Really quite curious about it. And then that's why after that, the invention of the treatment using the T1DM, several times before at the international conference as a speaker, I participated. And then during my research field, and then 28 countries, my T1DM patents, and then the registration. And then so just only one raw material is the immaculate. That's the in Chinese pronunciation is the Jishran. Do you know it? Insect. Yeah, eight years ago in Korea it was allowed as food. In most of the advanced countries, more than 10 years ago, it is allowed to have food. But I don't know in China here now. But anyhow, using these raw materials, I make some results from the diabetes and sexual dysfunction and infertility problem, and then the thrombus formation and the stopping the atherosclerosis, and then the hair growth and hair quality increase, and also together osteoclast differentiation and then the bone reduction. Yeah, we could correlate the osteoporosis. And then also whitening and moisturizing, and then inflammation. I think one of the most important things in my research is anti-inflammation. And then they also for the aging groups, the sarcopenia. And then the bioavailability, and then we can increase the digestibility when we intake use this one as food. And the hippocampal protection effect.
Okay,
I'm sorry.
let me briefly introduce you first. 李三九教授他是韩国的239生物医药的首席执行人和创始人。他以前他也是全北国立大学的教授和国际的粮农组织的一个代表。他主要研究方向呢就是可食用的昆虫。然后他在这个领域呢，他做了一些相关的研究，包括在糖尿病，还有男性的性功能障碍和不育，以及呢血栓、动脉粥硬化，还有就是毛发的生长以及骨质疏松、美白、炎症以及呢肌少症等等，还有认知方面呢都做了相关的研究，有18个领域的一个专利持有。那么他曾经在这个国际的食品和营养学的会议，多个国际会议上呢发表过演讲，所以他今天会给我们带来的这个内容呢，就是糖尿病患者他的贝塔细胞功能的再生以及呢停止糖尿病药物以及胰岛素注射的这个相关的他们这个该用的研究。OK。
There is a saying that from the Hippocrates, and this would be by medicine, and medicine by food. There's the Chinese version. There's the Yao Shi Tong Yuan. Can you understand? Yao Shi Tong Yuan, yes.
Everybody can understand that.
Okay. Here today I will say about the T1DM.
下一个呢，他就要说他研发的这个产品叫 T1DM。
So most of the people in Korea, they have some kind of curiosities on what is studied from the animal trials before. It was the streptozotocin-induced type 1 diabetes, and then 180 rats.
所以他本人呢是从糖尿病的兴趣出发呢，开始对于一个一型糖尿病的患者呢，一型糖尿病的大鼠进行了动物实验。
And the problem started my research, and then it was self-question and challenges from myself. And then is it possible to be a therapeutic, and then recoverable, or be reversible, and then regenerative and preventive?
他本人比较好奇，这个一型糖尿病患者有没有可能被治愈以及被恢复，可不可以被逆转或者是再生？
So this is the DD, and then I think in a sense kind of paradigm shift because no more dependent of diabetic drugs and medications and insulin injections or insulin pumps.
他认为呢，T1DM这个产品对于糖尿病呢有一定的疗效，可以让患者呢对于药物呢减少依赖。
And then I always think about the competition of medications, insulin, and our research results.
他把这个产品呢当做是糖尿病药的一个竞品。
Yeah, it was costly, but very quite effective and fast, especially for the seriously deteriorated patients with complications.
以及呢能减少这个糖尿病的一个并发症的发生。
It is the daily meal supplements for the diabetic patients.
它是这个每天都要这个，它是一天一次一包50克，然后呢也可以1天1到2次的进行服用。
And then how many patients? Maybe you were curious about the actually accumulation of the data from the hospital. It was 575, but after that accumulation of data, and then more than 1,000 patients participated in our research.
在韩国呢，已经在累积这些相关的研究数据。那它目前呢，已经有575名糖尿病患者使用它的产品，但是呢，实际上呢，有超过1000个人呢已经在应用了。
Mandatory. That is the lifestyle, daily lifestyle intervention and physical activities, and then the ocean diet kind of, and then no salt to drink, and no high carb, and at least 1 hour walking, and 30 minutes of step climbing, and 30 minutes of indoor biking.
它的产品呢是要和生活方式以及呢健康饮食干预呢同时进行。那么在生活方式的干预和体育锻炼中呢，包括要不喝软饮，无碳水，无高碳水，然后呢坚持1小时的步行，或者30分钟的楼梯，或者是30分钟的室内自行车。
This is the guidelines for the patients. The left is in Korean, but I rewrite it again into Chinese, but the accuracy is a little bit lower, I think.
这是他做了一个给患者的一个饮食指南。
Maybe you know more than 1,000 years ago in China, there was like a game that's a cricket fight in China. Do you know?
就是斗蛐拳。
Yeah. And then I call this raw material for the diabetic patients and then the unhealthy people who are suffering from the disease. This is called the hidden treasure. That's the shisha into Chinese, shisha. The scientific name is Primus demaculatus. And it is the really sustainable protein source for disease treatment with good nutrition.
那么，李教授呢认为呢，这是一种隐藏的宝藏。那它的学名呢叫做双斑蟋蟀。双斑蟋蟀呢是一个可以作为疾病治疗的可持续的蛋白质来源、可食用的昆虫，具有很好的营养价值。
Yeah, in my research, the most important thing was the nutritional value of my raw material, because the protein quickly increased 70%. 70 grams per 100 grams. It is nearly 7.5 times of the meat, pork, and chicken. And also, 8 kinds of essential amino acids is more than 20 grams per 100 grams. And also the total BCAA, that's the branched chain amino acid. It is the 3 components: valine, fusion, and isolation. And it's more than 10 grams. And also, unsaturated fatty acid. That is the oleic acid and linolenic acid and alpha-linolenic acid.
那么双氨蟋蟀呢，它有非常丰富的营养成分。那首先它的蛋白质呢超过肉类的3倍，每100克中呢含有70克的粗蛋白。另外呢，必需氨基酸呢每100克中含有22克，其中呢缬氨酸、亮氨酸和异亮氨酸呢也比较丰富。另外呢，不饱和的脂肪酸中也含有丰富的油酸、亚油酸和阿尔法亚麻酸。
Yeah, before I came to China, and then I checked about the journals for adult insects in China. There are so many, but in Korea I checked most of the 200 adult insects related journals.
那么在中国呢，也有一些相关的研究蟋蟀的报道，作为一个数据统计。
And then after the successful research results, and then I traveled here and there. It was the delivery of good news for the diabetes. And then it was the 2018 Helsinki, Finland here, Professor Yako, and then Dubai. It was the first travel for the delivery of good news.
那么，李教授呢，也在全世界各地呢，他发现了这个双氨蟋蟀对于糖尿病带来的获益之后呢，在全世界各地的大会上呢也做过演讲，也是在2018年芬兰的这个糖尿病学术会议中呢认识了袁普教授。
It was the 2019, right before the COVID-19 era. It was travel for India.
他在这个2019年呢去了印度，然后进行了演讲。
The title was the Novel Non-Pharmacological Treatment of Diabetes using alternative protein and nutrition.
也是关于呢这个使用这个蟋蟀呢，它来进行这个 T1DM 产品来进行糖尿病的预防和治疗。
This is the Mauritius Republic, January this year.
像我们展示的是今年他在毛里求斯呢进行的这个会议和演讲。
Yeah. And then Professor Yako. And then September this year, it was the 11th World Congress for Prevention of Diabetes.
这是今年的9月份在印度的孟买参加的糖尿病预防会议。
Yeah, here I am, and Professor Yako is here. And the topic was the extended work. It was because we found out, we make some conclusion from the research, and that there was the direct link between diabetes and Alzheimer's disease in recent scientific results.
他发现呢，在使用蟋蟀替代蛋白非药物治疗糖尿病的新方法呢，可以对于阿尔茨海默病之间呢也有一定的疗效。
If I conclude about the 10 pills of research result, I can say that we concluded some kind of biomarkers for the anti-aging.
那么他在这个10个领域中呢进行了研究呢，汇总的方面呢就是抗老。
And the journals for the Science and Nutrition, it was 2019.
在2019年呢，在营养的杂志上面也发表了相关的文章。
It was the MOA, mechanism of action was the AKT and mTOR-pathway.
它是研究了一个通路pathway biomarker.
All of you here may know about the importance of the HbA1c, and then you see even the streptozotocin-induced diabetic rats rapidly reduce the level of HbA1c.
他发现呢，在小鼠的在大鼠的研究中呢，异性糖尿病的大鼠中呢，糖化血红蛋白的水平呢，应用对的治疗组呢是下降的。
And this is the beta cell regeneration. As you see here, this is the normal, and then after the streptozotocin induced, and then the beta cell is destroyed totally. But with the dosage-dependent DID, lower level and medium and high level, as you see, from nothing and to increase nearly normalized.
他在异性糖尿病的大鼠中呢，发现应用了 DMD 之后呢，引导功能呢 是从一个破坏转向恢复。
And as you know, the function of the beta cell, that's the secretion of insulin in our body. As I said, this is normal, and then we just streptozotocin induced, and then no insulin secretion. But with the DMD, as you see, increase the amount of the insulin secretions like this.
依然就是在婴儿DMD之后呢，它的胰岛素分泌是增加的。
So, in my research field, the importance is the C-peptide level.
所以他认为呢，对于 C 肽和胰岛功能来说呢 ，DMD 是有一定的效果。
As you see, the C-peptide and insulin secretion is the same phenomenon here, because it is increased to the level of C-peptide and then the insulin secretion too.
他认为 C 肽胰岛素是一样的，事实上它没有外源性胰岛素嘛，OK。
Yeah, this is used from the total recovery as a diabetic patient. He was 58 years old, male, and then more than 20 years of diabetes. But he studied with metformin from type 2. But 20 years later, he became type 1. So his dosage of daily insulin pump was 56 units daily. And then his C-peptide was 0.17. And then his HbA1c 9.7, but nearly no insulin secretion. And his complications about the retinopathy, diplopia, and then the myocardial infarction, and the hearing impairment, total no hearings. And then tooth extraction, 11 tooth extracted, and the erectile dysfunction and having paralysis. 3 years later, just normalized into 1.32. And his insulin was from nothing to 3.5, normalized.
OK， so 他在这个异型糖尿病的一个患者中，因为糖尿病20年的一个二型糖尿病患者，然后在20年之后呢，被诊断为异型糖尿病。那么他之前的胰岛素用量呢是56单位，然后呢 C 肽的水平之前是非常低的，只有0.17，糖化血红蛋白9.7，基本上没有胰岛功能。那么在这个在这个应用了这个它的这个干预之后呢，他发现这个胰岛功能呢是有一定的恢复，而且糖化血红蛋白呢也比较好，同时呢停止了胰岛素的用药。另外，对患者还有一个口腔的一个外破。
He was the 58 years old male, but this time 6 years old, type 1 diabetes. And then people did take insulin injection. The basal insulin was 10 units, and then every meal 3 times a day, and then 6 to 7 units a day. So totally you could say 28 units. But just right after diagnosis, her insulin level, just basal insulin, is just 2 units from the first day. And then after breakfast, no insulin is needed. And then after lunch, 2 or 3 units, and then the dinner, no. So her PTQ level was nearly 400, even though with the insulin injections. But from the nearly 28 at 4 times a day, but just only 1 time after lunch, just 2 3 units. And then, as you see, this is the CGM. And then her CGM at the hospital, University Hospital, this is the nearly 400 after the meal.
这是他的另外一个病例，是一个60岁的异型糖尿病患者，曾经被诊断为糖尿病酮酸中毒。诊断初期的 C 肽水平只有0.24，血糖是很高的。那在应用这个 DMD 之前呢，它的基础胰岛素，基础率是10，3餐前的这个代谢量是666，大概每天需要28单位的胰岛素。那在用了这个药物之后，它的胰岛素用量呢是大幅度的下降，仅在午餐的时候需要2到3个单位的胰岛素注射，餐后的血糖呢达到一个正常的水平。
Yeah, it is to our diabetes. We extended our research into the testosterone and infertility, I mean the blood circulation.
那他对于睾酮的水平以及不孕症呢，也进行了相关的研究。
As you see here, the serum testosterone and then the LH hormone and then the FSH hormone is reduce and increase the TNF-alpha and then IL-6. For the inflammation, IL-6 and TNF-alpha rapidly reduce.
他说的这个指标也快速的下降。
And then the MDA and then the RS-ILS and then that is the anti-oxidative stress reduced.
氧氨基的指标也逐渐的在下降。
And then for the antioxidants, SOD and GPS and catalase increase.
另外有几个指标是升高的。
Yeah, this is our diagram for primary research results.
这是他的做了一些氧化应激通路的研究，然后呢看了一下它一些相关的生物标志物，包括炎症，包括这个激素的水平。
Yeah, hormone research is for the inhibition of osteoporosis.
那这是这个药物对于骨质疏松方面的一些研究，他做的一些研究结果。
And then also from the blood circulation, it was funded by the government, and then it was the prevention of thrombus formation and atherosclerosis.
那它对于预防动脉粥硬化一些的研究。
So that's why we could find out the biomarkers direct linkage between the diabetes and Alzheimer's disease in biomarkers.
他们还对这个阿尔茨海默病之间，糖尿病和阿尔茨海默病之间的联系与主要的生物标志物进行了探索。
So that's why we, in the process of analyzing, we found out the activation and inhibition of these biomarkers.
那他发现了这个主要的几个生物标志物，那运用了这个药物之后呢，它这几个生物标志物被激活，另外呢，就是在预防阿尔茨海默病中呢可能会起到作用。
So those two figures, IL-6, interleukin-6, and TNF-alpha, this is very important for the cancer patient or the inflammation and the diabetes or Alzheimer's disease.
那么他在肿瘤、炎症和阿尔茨海默症中呢，他研究了 TL6和 TNF-alpha 几个指标。
This one is 39 years old male, and HbA1c 10%. His metformin was 1,000 milligrams, and insulin injection and 10 units for 24 hours. And his C-peptide is just 0.39, and this is too huge. His IL-6 level before gene intake was 2,075 at the University Hospital.
那么这也是一个病例呢，他在医学糖尿病伴有轻度认知障碍的患者中，进行了研究，然后这是一个39岁的男性，B 出糖化血红蛋白是10.6，应用2甲双苷1000毫克，胰岛素注射量呢是10个单位，那么他的这个白介素6的水平非常高，2075。
But right after 3 months with gene intake, his IL-6 rapidly reduced, getting normalized from the 2075. It is the 1.5.
在进行了使用 DMD 3个月之后呢，它的这个C 肽的水平显著的提升。
And then no medications and no insulin injections, and getting normalized, and then change into everyday normal life.
他说他的患者呢就没有再用药物治疗和胰岛素注射，也逐渐的日常生活呢和正常人一样。
This is the diagram that I described about the how the health brain changes into the Alzheimer's disease.
另外呢，他就是想研究是如何在大脑如何在阿尔茨海默病人的大脑中和正常人大脑中起到的作用。
This is the concluding diagram for the research results, because beyond diabetes, we can find the direct linkage between biomarkers, diabetes and the Alzheimer's disease.
那他在糖尿病之外呢，治疗之外呢，他也在寻找抗 阿尔茨海默症的一些生物标志物对这个药物对这个 DMT 对于这个生物标志物之间哪个标志物起到作用。
And for the exact comparison from the patients, all the patients they have to submit the serum results from the hospitals.
这些病人呢，他都进行了相关的临床数据的分析。
This is for the type 2 diabetes. From the HbA1c to the how many drugs or the insulins like this, they have to submit to us.
这个是糖尿病患者，他包括糖尿病患者，他用了多少胰岛素，等等相关的临床数据。
Here, the importance was the weight synthesized, and then the insulin resistance for type 2.
那对于二型糖尿病来说，主要的就是胰岛素抵抗和胰岛功能。
And for the type 1 diabetes, they have to add up some the DKA or not, and then IAA, anti-GAD or GAD65, and then anti-IA2, and then anti-thyroglobulin AB, and then anti-TQAB.
那么对于一型糖尿病患者呢，他们在观察的时候还增加了是不是增加一些指标，包括是不是存在糖酸中毒，是不是在用药过程中它的自身抗体的变化，以及抗 LADA、抗 65 抗体，以及呢相关的 IA 抗体等。
Classified as 8 groups. One is juvenile T1DM, and then second is adult T1DM. 3 is LADA type. 4 T2DM medication only, and 5 T2DM medication plus and insulin injections. And 6, mild complication study, or 7, serious one, and then 8, prediabetes.
他把这些患者呢分为8个组别，包括一型糖尿病、青少年17岁以下一型糖尿病、成人的一型糖尿病、LADA 2型糖尿病、糖尿病仅用药物治疗和胰岛素治疗，以及呢有轻微并发症和伴有严重并发症糖尿病前期8个组。
From these 8 groups, 2 groups are should be exempted because number 1 and number 8, those groups are not that quite effective.
That group
1 and 8. 1 and 8.
Is the most effective.
Nothing effective.
Nothing effective. 他说第一组和最后一组是没有效果的。
Here I have 3 cases in the diagram, and for the type 2, just 5 days of changes, medication case. And then he, when diagnosed, he is 63 years old and is 52, 380, and fasting is 280, and the HbA1c is more than 10%. But as you see, rapidly reduce their blood glucose from the first day to the final day, 5 days.
他说这个也是一个病例，是一个男性的患者，在用了这个DMT 之后的5天，他的空腹血糖就发生了一个显著的下降，超过36%。
Yeah, this is for the female case, and she was diagnosed. Her 52 was 332, and fasting 284, and HbA1c is more than 12. But as you see, the fasting at 52 is nearly a minus 41% reduction and 48% reduction.
Is this a type 2 diabetes patient? Professor Lee, is this type 2 diabetes?
Type 2, yes.
OK， 这是一个2型糖尿病的女性的用药患者。那她属于用药组，她在使用 DMT 之前和之后，她的空腹血糖下降了41%，餐后血糖下降了48%，也是在5天之内。
This one is for the type 1 case, insulin injection case, and the 52 years old male, and the 52 was 481 before the intake, and then his fasting was 481, HbA1c more than 11%, and the insulin was 52 units, but the medication 2,500 milligrams, and 11 years of diabetic history.
这是一个1型糖尿病的患者，在用药8天之后，他的胰岛素用量的变化，我们可以看到他这个患者呢是一个男性，52岁，在之前呢使用胰岛素是 52个单位，然后病史有11年，同时他还有口服2500毫克的药物，但是他没有说什么药。
That is a quite rapid reduction from 400 something into 120.
他的血糖呢，从481毫克每分升下降到了102，是在8天之内。
This one is the mostly serious case for the diabetes patient. Most serious case because he is 56 years old and the diabetes 20 years and the medication twice a day and insulin injection 100 units daily basis. But he has complications and also low and then retinopathy and hypertension and the neuropathy and night urination and hence the edema and then the myelinosis.
这个是一个56岁的男性患者，also type 2 diabetes, right? Type 1，他这是1型糖尿病56岁的男性糖尿病患者，也是病史有20年。那他在使用这个片之前呢，他的药物是1天2次，胰岛素注射是100个单位，参考量是血糖是289，空腹血糖300。在用药10天之后呢，他的参考量是血糖从289降到120，胰岛素注射的剂量由100下降到20。
Just in 10 days of daily intake, and in his postprandial 2 hours, 58% reduction, and then his insulin reduction was 80%.
胰岛素的使用量减少了80%，血糖下降幅度是58.4%。
So the clinical report, we analyzed 575 diabetes patients like this.
所以他们纳入了575名糖尿病的患者。
So we confirmed the efficacy of the recovery of the peptide, and then it is very easy to normalize their HOMA-IL, and the stopping medication, insulin injections, yes, and then over 80%, and the complications should be can be alleviated. And how many patients? Yes, nearly more than 1,000.
它对于疗效的阶段性评价呢是，首先这个使用这个电力产品是不是能够促进仪器它规定了，它认为是的。另外呢，是不是很快的可以实现HOMA-IR的正常化，它认为是的。另外呢，在超过80%的患者中呢，他用的治疗药物和胰岛素注射呢是减少的。另外呢，并发症是有所缓解。那有多少患者呢？他目前已有超过1000人。
So the efficacy from the data, and we confirm the therapeutic effect, and then the HbA1c reduction is quite fast, and the type 1 diabetes patient recover from the C-peptide and insulin secretion. It is quite important for all of you here. And then even the highest triglyceride, such as 1,400, it can normalize in 3 or 4 months later. And then they can remove their insulin pump and insulin injections.
那他认为呢，在他的这个1000个患者的电力疗效总结下来呢，首先就是对于糖尿病有一定的治疗效果，糖化血红蛋白可以下降。另外呢，对于1型糖尿病患者 C 肽的胰岛素分泌可以改善。还有呢就是可以减少胰岛素泵或者是停止胰岛素的注射。在并发症方面呢，也有相关的改善作用。
Yeah, this is a book I wrote, the stories from the patients in the process of the overcoming diabetes. It was the 2020.
他发表的这个书，是在2020年发表的一个书，关于这个电力对于糖尿病的治疗的预防作用。
Yeah, this is the final, and then here I'd like to suggest one thing, shouting. I mean, shouting. Yeah. If I say we, then would you? Yeah. If I say we, and then would you say the one team? Yes. Loudly, okay? Okay, thank you for listening here. And then we. One team. That's right. Thank you.
I was shocked by your results.
Thank you.
You see, I know that there is a publication on is in food and medicine. Food and medicine, especially in the US journals, they have talked about that food and medicine. But
How is she coming in?
I don't know if this food is replaced with normal diet or only additive to the normal diet.
Yeah.
For the patient.
Yeah.
Additive or replaced.
This is actually study from the food supplements for every patient.
The patient consume normal diet.
No problem at all.
And you
Even a healthy person, they can do. And if they take pills, and then their vitamin is,
I think treat basically with the patient with type 1 diabetes.
Type 1 and type 2, and even the LADA type. Every type of diabetes, they can consume this. But just one thing, for the shrimp allergy person, no. Shrimp allergy. Crustacean allergy.
Sorry.
You know the crustacean, shrimp allergy, if they have some allergy to shrimp or the crustacean. Yeah, shrimp. 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 Yeah.
Is that a sea animal shrimp?
On the sea.
Shrimp. 那是那种虾的。
然后本来一张票看的时候特别If you have any comments about this research results, to use additive to treat type 1 diabetes. Have any comments about this research results? To use additive to treat type 1 diabetes or LADA.
Yes, thank you very much, Dr. Lee, about this summary. I find it very important today that we have alternative ways of treating diabetes, not only using medicines that are produced pharmacologically, but we use non-pharmacologic therapies, and I believe this is one way to help the population to create new approaches. We still obviously are in the beginning to understand what's going on, and we need many studies, we need trials to prove that things are actually going as well as it seems. Maybe in Dalian there will be some studies in the future.
Thank you. Yeah. I'm very encouraged by the results. We need more RCT, that control trial for your additive to the diabetes patient and control. Yes, I have one patient from the Foreign College, the Dalian Medical University, one professor who is also a Korean nationality, and he once studied in South Korea and come back with diabetes with LADA diabetes. And I when I prescribed insulin to him, he refused. He told me that he used a food, really, your food. He told me that his severe control is very good. So I lost follow-up for 3 years. I don't know. 就是我曾经有一个大外的朋友，一个教授，他是在南韩学习进修，回来以后呢，本来他家里他是个本来是肝很高的，他本来是个拉大，是一型嘛，没有通体。他当初给他打药，给他打胰岛素，他说后来他就割了好长时间没给我回。后来在外面他说我没打胰岛素，我没干什么呢？我吃了一个药，说吃这个就是南韩他给这个食，可能就这个东西我也不清楚。他说我想他口味挺好，不用买胰岛素。我到现在还在 2、3年了也跟我联系，因为总是没时间嘛，总想找个时间再来努力朋友嘛，也会想问问他到底是怎么样的。这也许吧。所以今天这个研究给我感觉非常准确，非常绝对突破了我们的想法。One question of my class is using protein. When you inject protein, the protein will digest in the intestine, in the gut. And what about the nutrients, the therapeutic nutrients that are probably helpful for the diabetes control?
Yeah, during my research, and then why most of the patients they feel the same phenomena from our research. That was as you pointed out, that was the digestibility. You know about the whey protein. Whey protein is a little bit costly in South Korea. And then youngsters usually take the whey protein for their health. And then we analyze, and then the digestibility is better than whey protein twice. And then the BCAA, that is the branched chain amino acids, and also together with the digestibility, and then unsaturated fatty acid too. I think those are the main factors affecting our human health.
刚才问题是蛋白质吃到嘴里全给消化掉了，那它的有可能的治疗成分是什么？他跟我说是，他举个例子就是讲那个大麦蛋白，像麦蛋白很难消化的。他说他这个时候中的消化能力很强，是它的2倍，这是第一个。第二个呢，说这里头还有一个致癌物酸，叫 BCAA， 它有可能是有胰岛素和别的情况，它刺激到这个，我想是duodenal intestinal tract by the effect size of size, right?
对。
就那个12指肠的这种可能起来作用，这个时候还没有完全破坏掉，在那个地方它作用在我们的 L 细胞或什么细胞上，什么细胞很重要的作用。最近有个研究就是把那个12指肠的这种跟它那个射频消融的，就是破坏了以后，然后它俩病体重不下来，血糖也好了，然后大家长回来也恢复。所以这也是一个很重要的作用必点。Thank you。这个下边。
That is Professor Zhang Ping coming from the first department of endocrinology director in our hospital. So she wanna ask Professor Lee about for the patient in type 1 diabetes in your trial, how many type 1 diabetes for how long it can reduce the insulin doses, and how long does this effect last for?
Okay. Actually, for the data from the human patients, it was for the type 1, it was more than 175 in 575 patients. And then the how long, the duration of the GAD and the recovery time is very different according to the symptoms. So when they diagnosed 10 years ago or 1 year ago, just right a week ago, if they come right after the diagnosis in type 1 from the university hospital, then they call to us, and then just less than 3 months to be getting normalized. But if more than 1, 3, 5 years, and then will take more than 2 years to be get back to the normalized C-peptide level and then the insulin secretion. Also, if they have some kind of 5 or 6 complications ready, then the delay. And then in that case, we said, okay, just no more complications. And then your insulin injection will be gradually reduced. So you have to keep your patience.
So how long this kind of effect will last?
Okay. Yeah, the last one is if they, so that's the kind of habit. They have to change all the daily habits after getting normalized. Yeah, C-peptide is getting normal, but their insulin secretion is getting normalized. But if they do not, the lifestyle intervention.
Okay. So you mean it depends on if they can change their lifestyle.
Yeah, as Professor Yako pointed out, that's the lifestyle intervention they have to start.
他说呢，在他的585个糖尿病患者中呢，有175个乙型糖尿病的患者。那么针对多长时间会起效呢？他在研究中发现了越早使用，比如刚刚开始就诊断糖尿病的患者中使用他的这个 DMD 之后呢，大概不超过3个月就会出现这个胰岛素和药物就是胰岛功能的恢复。那么如果说患者已经诊断了几年，在这种情况下呢，起效会相对来说缓慢一些，但是不超过2年。那如果已经合并有并发症的情况下呢，它这个起效呢会更缓慢，但是胰岛素的用量呢会下降。另外呢，就是它的这个胰岛素持续时间，这个胰岛素减少使用的这个效应能够持续多久？他说这个是因人而异的。最重要的就是在停止和减少胰岛素使用之后呢，他的生活方式是不是能够跟着改善？如果生活方式没有改善的话，还是会再回去。
由于时间的关系呢，如果大家还有什么问题，我们可以。
So, the DMD is the drug is food.
Right.
So, may I think is anti-diabetic food?
No problem.
It's anti-diabetic. So, for the patient, how to balance the safety and the powerful efficacy of the anti-diabetic? I mean, the hypoglycemia.
Safety?
Yeah, safety. Hypoglycemia, not hypoglycemia.
No. They don't have to worry about the hypoglycemia. Because they have to control their insulin injection. If they 30 units a day, and then they gradually they have to reduce day by day, and then nearly from our analysis, nearly half of their insulin units they have to cut in 1 month. If they 50 units, then it will be reduced to the 25 units in a month. So gradually reduce the level of insulin injection, and then no more hypoglycemia.
So for your patient on the EMP and no hypoglycemia? No hypoglycemia?
No.
时间的关系，我们今天到这儿。接下来我们下一个主持人So let's hope for the best. Thank you again.
Thank you for listening.
Pharmacologically, but to use non-pharmacologic therapies, and I believe this is one way to help the population to create a new approaches. We still obviously are in the beginning to understand what's going on, and we need many studies, we need trials to prove that things are actually going as well as it seems. Maybe in Dalian there will be some studies in the future.
Thank you. Yeah. I'm very encouraged by the results. We need more RCT control trial for your energy to the diabetes patients that can control. Yes, I have my patients. from the Dalian Foreign Language College, Dalian Language学院, one professor who is also a Korean nationality, and he was studying in South Korea and come back with diabetes with LADA diabetes, LADA. And I when I prescribed insulin to him, he refused. He told me that he used a food, meaning your food. He told me that his severe control is very good. So I lost follow-up for 3 years. I don't know. 就是我曾经有一个就大外的朋友，一个教授，他是在南韩学习进修，回来以后呢，诊断糖尿病，他是个诊断是肝胆糖很高的，诊断是个LADA，是1型的，还有酮体。所以当时我给他打药，给他打胰岛素，他说后来他就又割了好长时间才没给我回。后来再问他，他说我没打胰岛素，我这干什么呢？我吃了一个药，说吃这个就是南韩他是给了一个食，可能就这个东西吧，我也不清楚。他说我血糖控制挺好，不用打胰岛素。我到现在还最近2、3年了也没跟我联系，因为总是没时间嘛，总想找个时间再问问，有必朋友嘛，再给我讲问问他到底是怎么样。这也许吧。所以今天这个研究给我感觉非常对名，非常绝对突破了我们的想法。One question I'd like to ask is, you say protein. When you inject protein, the protein will digest in the intestine, in the gut. And what are also the nutrients, the therapeutic nutrients that probably helpful for the diabetes control?
Yeah, during my research, and then why most of the patients, they feel the same phenomena from our research. That was as you pointed out, that was the digestibility. You know about the whey protein. Whey protein is a little bit costly in South Korea. And then youngsters usually take the whey protein for their health. And then we analyze, and then the digestibility is better than whey protein twice. And then the BCAA, that is the branched chain amino acids, and also together with the digestibility, and then unsaturated fatty acid too. I think those are the main factors affecting our human health.
刚才外头说蛋白质吃到嘴里全给消化掉了，那它的有可能的治疗成分是什么？他跟我说是，他举个例子就是那个大麦蛋白，就是麦蛋白很难消化。他说他这个食物中的消化能力很强，是它的2倍，这是第一个。第二个呢，在这里的话有一个质量氨基酸，就 BCAA， 它有可能是有对这个胰岛素它的别的情况，它刺激到那个，我想是duodenal intestinal tract might be the effect size of the site, right?
Right.
就那个12指肠的地方可能起到这个作用，那个时候还没完全破坏掉，在那个地方它作为我们的 L 细胞或什么细胞可能起到很重要的作用。最近有个研究就是把那个12指肠的地方给它用那个射频消融了，这个破坏了以后，然后糖尿病体重都下来了，血糖也好了，然后大家长回来又恢复了。所以这也是一个很重要的作用一点。Thank you。那个下边这个问题挺有意思的，我也希望听听下边有什么 question。Any question？
我想问，持续多长时间能减少80%的氧素含量？小陈，你帮我翻译一下吧。我对这个研究很感兴趣，但是我更感兴趣就是说那些能减少80%胰岛素用量的1型的。因为它有一个表格，第一个表就是8个组，1型糖尿病有效，糖尿病前期无效，后来说的，你记不记得？但是它又提供有一个第2个图呢，就是一个6年的糖尿病1型糖尿病病史的人，他胰岛素用量减少了很多。我想问，在1000例使用的病人当中，真正1型糖尿病的病人用了这种疗法以后，他的胰岛素减少持续了多长时间？我们想知道的不是一开始病用以后这胰岛素就减少用量，心态就恢复了。它持续多长时间？那是不是经过一段时间以后，它又重新又恢复胰岛素的用量
？For the type 1 diabetes. What?
So, okay, that is Professor Zhang Ping coming from the first department of endocrinology director in our hospital. So she wanna ask Professor Lee about for the patient in type 1 diabetes in your trial, how many type 1 diabetes, for how long it can reduce insulin doses, and how long does this effect last for?
Okay. Actually, for the data from the human patients, it was for the type 1, it was more than 175 in 575 patients. And then the how long, the duration of the GMD and then the recovery timing is very different according to the symptoms. So when they diagnosed 10 years ago or 1 year ago, just right a week ago, if they come right after the diagnosis in type 1 from the university hospital, then they call to us, and then just less than 3 months to be getting normalized. But if more than 1, 3, 5 years, and then will take more than 2 years to be get back to the normalized C-peptide level and then the insulin secretion. Also, if they have some kind of 5 or 6 complications later, then the delay. And then in that case, we said, okay, just no more complications. And then your insulin injection will be gradually reduced. So you have to keep your patience.
So how long this kind of effect will last for reducing the insulin?
Yeah, the last one is if they, so that's the kind of habit. They have to change all the daily habits after getting normalized. Yeah, C-peptide is getting normal, but their insulin secretion is getting normalized. But if they do not, the lifestyle intervention.
Okay, so you mean so it depends on if they can change their lifestyle.
Yeah, as Professor Yako pointed out, that the lifestyle intervention they have to start.
他说呢，在他的585个糖尿病患者中，有175个一型糖尿病的患者。那么针对多长时间会起效呢？他在研究中发现了越早使用，比如当他开始就诊断糖尿病的患者中使用他的这个 DMD 之后呢，大概不超过3个月就会出现这个胰岛素和药物这个胰岛功能的恢复。那么如果这个患者已经诊断了几年，那这种情况下呢，起效会相对来说缓慢一些，但是不超过2年。那如果已经合并有并发症的情况下呢，它这个起效呢会更缓慢，但是胰岛素的用量呢会下降。另外呢，就是它的这个胰岛素持续时间，胰岛素减少使用的这个效应能够持续多久？他说这个是因人而异的。最重要的就是在停止和减少胰岛素使用之后呢，他的生活方式是不是能够跟着改善？如果生活方式没有改善的话，还是会再回去。
由于时间的关系呢，